Medical interventions in fertility have transformed how people experience parenthood. How can clinicians navigate the intricate emotional landscape created by assisted reproduction? In this episode, Renata Viola Vives and Teresa Vale explore the complex relationship between assisted reproduction and psychoanalysis, drawing from their edited book, Pregnancy, Assisted Reproduction and Psychoanalysis, published by Routledge. Conceived through years of clinical work and shaped by the collaborative encounters fostered by the IPA Women and Psychoanalysis Committee, they explore how contemporary practices redefine our understanding of parenthood, identity, and desire. Drawing on their extensive experience, the authors address the historical tensions between psychoanalysis and reproductive technologies and highlight the need for a nuanced approach. By examining the emotional impact of procedures like gamete donation and surrogacy, they emphasize the importance of understanding the anxieties and fantasies that accompany these kinds of journeys to parenthood. Renata Viola Vives is a clinical psychologist and psychoanalyst, member of the Brazilian Society of Psychoanalysis in Porto Alegre, and currently Latin America representative of the IPA Women and Psychoanalysis Committee. She is an editor of books on parenting, assisted reproduction, and adoption. Teresa Vale is a clinical psychologist and psychoanalyst, member of the Portuguese Psychoanalytic Society, teaching in her society's training program, and she's assistant director of the Portuguese Psychoanalytic Journal and European representative for the IPA Women and Psychoanalysis Committee. This episode is presented in English, Portuguese, Spanish, and French. The English version is read by Teresa Vale. I am Gaetano Pellegrini with Talks on Psychoanalysis, the IPA podcast devoted to topics published in the IPA Society journals and Congress debates worldwide, featuring the original voices of the authors. This podcast series, published by the International Psychoanalytical Association, is part of the activities of the IPA Communication Committee, editing and post-production Massimiliano Guerrieri. And to stay informed about the latest podcast releases, please sign up today.
Assisted reproduction has been shown to be a modern and widely disseminated approach to address childlessness. This term designates a series of methods and techniques that make it possible to carry out pregnancies that would not happen spontaneously, placing medical technological intervention as a condition for its occurrence. Despite the fact that it is an increasingly present topic in our clinical practice, myths and prejudices remain rooted that can prevent a therapeutic or analytical work from being fruitful. In fact, the relationship between psychoanalysis and assisted reproduction has been somewhat troubled, given that classical authors tended to consider infertility, pregnancy loss, and other reproductive upheavals as exclusively resulting from women's unconscious interpsychic conflicts. This interpretation ended up being accusatory, reducing infertility to the idea that if a woman does not get pregnant, it is because she does not want to become a mother or does not desire the baby. Furthermore, when assisted reproduction techniques began to develop, they were sometimes considered by analysts to be omnipotent movements and therefore pathological ones, with the idea being disseminated that for a woman suffering from infertility, the healthy way out, it would be to mourn her fertility and accept the idea of a life without biological children. The first works on infertility came from Ellen Deutsch, followed by the work of Dinah Pines and Mary Langer. Ellen Deutsch believed that women who were more immature tended to put themselves in a fragile and dependent position. In her perspective, these women were not able to step up to an adult position, which is why they ended up incapable of conceiving. In her opinion, in infertile women, paranoid fears prevail, which is why the woman would build different barriers against the incorporation of the penis or against sheltering the fetus, where the most superficial barrier may be the fear of defloration. In this context, frigidity could be a defense, as well as hormonal disorders, which would lead to the temporary damage to her femininity. For Langer, on the other hand, her starting point was the study of women who could not get pregnant, but who, from a physical point of view, did not present any problems, at least problems detectable by the medicine of the time. Langer stated that when these women were facing the possibility of making real their conscious desire, they became so anxious that they could lose, albeit temporarily, their fertility. She then deduced that their unconscious conflict with motherhood would have influenced their choice of partner and would later disturb their possibility of conceiving or carrying out a pregnancy. In her view, the unconscious conflict would come from early frustrations in a phase of extreme dependence in the relationship to the mother. For her part, Pines placed these problems in the context of the processes of elaboration linked to the different phases of a woman's development, namely the processes of psychic separation from the maternal object, and highlighted the presence of intense ambivalence, conflicts, and early trauma in cases of women with recurrent pregnancy losses and/or fertility problems. Although these authors' ideas may still be interesting, they are not applicable to all women and couples in these situations. On the other hand, they are still a simplistic approach to a very complex problem, conveying an omnipotent idea of psychoanalysis, in which reproductive troubles were solved by analysis. Thus conveying an idealization of the feminine, which only materializes through motherhood, and an idealization of motherhood, which is only the one that happens naturally, and in which the mother sacrifices herself for her baby and is always attentive to the needs of her children in the detriment of her own needs, psychoanalytic theory has kept many women and couples away from the analyst's offices. Therefore, these people went looking for other ways to deal with their psychological suffering resulting from infertility and subsequent treatments. In a contemporary perspective, it is important to highlight the various problems and questions that assisted reproduction may bring. But it is also important to accept that there are many forms of motherhood and many feminine identities. The female identity, like the psychic construction of the role of the mother, is an idiosyncratic construction based on a multiplicity of early and later experiences, primary and secondary unconscious identifications, anxieties, fantasies, unconscious representations of different natures. For this reason, there are as many feminine identities as there are women. There are as many motherhoods as there are mothers. In fact, in recent decades, we have experienced constant changes in our society, which have brought new subjectivities, as well as new models of parenting and family, which call into question our psychoanalytic theories and framework. The concepts of origin, primal sin, and Oedipal configuration are put into question and ask for further theoretical developments as babies are born out of surrogacy or through assisted reproduction procedures that involve so much more than just mommy and daddy. In fact, all these technological and social changes give rise to new family structures where different people play roles that didn't exist in the traditional family, necessarily influencing the emotional and sexual development of the child. Among these changes, the issue of motherhood has been undergoing constant transformation. From the 60s onwards, with sexual liberation and contraception, in the Western world, motherhood was no longer seen as a destiny, as a woman's duty. Abortion became legal in several countries, although today there is still a lot of discrepancy around the world in relation to this issue. Since then, a safe contraception would temporarily sterilize the woman, and a conscious decision would release her again for fertility, the baby being more the result of the woman's conscious wish and decision together with her unconscious desire, thus making the woman believe that she controlled her fertility by being able to inhibit it or not, becoming then responsible for everything that happened to her. Being the inhabitant of the body capable of gestating, this altered the relationship of women to their female body and to their sexuality. Resulting from these changes, the popular concepts of women, motherhood, and femininity are being reinvented in our societies, at the same time that the birth rate has decreased in Western countries and the age on average of the first pregnancy has been postponed. Nonetheless, on the same proportion that reproduction tended to become voluntary, cases of infertility grew. According to the WHO, a couple is considered infertile after a year of trying to get pregnant without using contraceptive methods. Again, according to the WHO, with data from April 23, 1 in 6 people worldwide are affected by infertility at some points in their lives, numbers that do not differ much in high, middle, and low-income countries. In the same context, reproductive technologies emerged, which brought about significant changes by intervening at the bodily level. Artificial insemination and the different in vitro fertilization techniques to some extent have solved infertility, allowing a pregnancy. In the late 70s in England, the first baby is born after being conceived in a test tube. Since then, more than 10 million children have been born in the world using assisted reproduction techniques, and this number is exponentially increasing. If beforehand we did not face doubts about what it is to be a mother, we are currently facing countless uncertainties. Genetic studies give us certainty about who are the biological parents, but not necessarily who will carry out maternal and paternal functions. As such, assisted reproduction technologies challenge our certainties, redefining the concepts of maternity, paternity, filiation at the conscious and unconscious level. Assisted fertilization with own gametes, with donated gametes, freezing of eggs or embryos, the surplus embryos, the surrogate pregnancy are some of the medical solutions to infertility. Medicine that continues to add new solutions, some of them sounding like something out of science fiction movies. In fact, the intervention of biotechnology, which initially focused on infertility, has extended to many other situations, among which the postponement of motherhood in situations of prolonged illness, in situations linked to the professional life, especially for women, or in situations of absence of a partner or age-related limitations, as well as parenting projects for homosexual couples who are no longer reduced to adoption. The desire for a child from the first attempts of conception until birth is always permeated by anxieties and unconscious fantasies. These fantasies begin to be built in the earliest childhood of both the boy and the girl, and are subject to transformation as the child grows and develops, and later on will be revisited when forming a couple. These anxieties and fantasies will also need to be negotiated and worked through in the transition to parenthood. However, when facing infertility, women and couples will face different challenges. We will find different scenarios, all coming with consequences for the emotional well-being of all parties involved. Undiagnosed situations that force couples to face and live with uncertainty. Unsuccessful treatments and pregnancy losses that demand a very difficult work of mourning. Gamete donation or embryo adoption that come with the need to elaborate the presence of another party and all the fantasies that it entails. Surrogacy that brings to the scene another body and another mind. All these situations that AR brings to the lives of contemporary patients demand a deep reflection and empathy from the part of the clinician. Assisted reproduction procedures may function as a third party in the relationship, in the sense that, instead of a sexual encounter, parents and children will have to deal with a set of technological scenes, medical exams, procedures, medical staff, as well as donors and recipients in many cases, and a series of fantasies and anxieties that do not usually belong to the universe of the so-called natural reproduction. And all this after many wounds experienced due to infertility. Today, we are aware that the work of analysis in these cases is not solving infertility per se, but helping the patient work out all the suffering and psychic consequences that this situation can bring. Furthermore, assisted reproduction procedures open up new possibilities that didn't exist before when the authors previously referred to wrote their work. Naturally, they didn't contemplate all the complexity of the situations we find nowadays. Along these lines, it is worth remembering the work of Sylvie Faure-Pragier, who argues that we cannot conceive a direct and linear causality for infertility or for reproductive problems in general. In her opinion, the label psychogenic infertility is meaningless. Faure-Pragier proposes a psychosomatic understanding of any infertility situation, in which unconscious aspects always play a role. But in her perspective, it's not only in sterility without a medical cause that emotional aspects take place. These play a fundamental role in any reproductive project. In fact, the author speaks of the psychosomatic nature of reproduction, in which the psyche uses the body as an intermediary for the expression of its unconscious conflicts, fantasies, and emotions. Several other authors are currently offering new meanings to infertility and to the conundrums patients face when they turn to assisted reproduction. They have addressed these issues exploring different aspects of this very complex problem, and the focus has shifted from the etiological question to the psychic consequences that these situations entail. Among the procedures that require from the patients a demanding emotional working through, we can think of egg donation and surrogacy. In both situations, the woman faces the fact that her eggs or her uterus are not viable, which most often is felt as her body not being good enough, leading to the need to resort to another woman's body. This situation may trigger several fantasies about the characteristics of the donor surrogate, about what the donor surrogate has that one has not, about what the donor surrogate brings to the subjectivity of the child to be born. What place will have the donor surrogate in the mind of the parents and in the mind of the child? Therefore, our aim as psychoanalysts should be to explore the contemporary world and its promises regarding pregnancy, infertility, and assisted reproduction, examining new psychic problems people are confronted with, which will need elaboration and working through, and looking for ways for better understanding the challenges the patients undertake and what kind of problems this brings into the analytic room in order to enable filiation and parenthood and allow emotional growth. The issues raised by assisted reproduction will appear more and more frequently in our offices, as technology will continue to evolve, bringing new solutions but also new questions. Psychoanalytic theory will have to follow this evolution, looking for different ways of thinking psychoanalytically about this wide topic.